In the 1960s, as people continued to live longer, a big question was, how do we care for people as they age? As a response, Medicare was created by our federal government under the Social Security Act to provide access to affordable care for people 65 years and older, as well as those with other special health care needs. Before then, many of these people didn't have access to basic health care and were at risk of financial hardship. Medicare gave them access. But was it good care? What about the quality? For a long time, our healthcare system has looked something like this. Healthcare providers and clinicians have typically worked independently with few opportunities to connect. The lack of coordination between different healthcare settings created potentially harmful, costly situations for patients. Overall, this siloed system did not provide patients with the best possible care. In 2002, the Quality Improvement Organization, or QIO program, was created under the Centers for Medicare and Medicaid Services, or CMS, to address the quality of care that patients were receiving. The program first focused on individual cases, then eventually CMS realized that greater systematic change was needed. CMS asked, how do we make widespread, rapid improvements in the quality of our healthcare system that keep patients healthy, active, and safe? The answer? By working together. Why? Because all people have a right to receive high-quality healthcare, especially our most vulnerable populations. And we've learned that when healthcare providers, patients, organizations, and communities work together, we make improvements faster. So how do we do this? The main goals of the QIO program are to lower costs, improve care, and promote better health. Currently, the QIO program is comprised of 13 organizations called QIN QIOs that cover all states and territories. From a national level, CMS looks at ways to improve systems. CMS then tasks the QIO program with improvement goals on specific topics. These goals are broad and diverse. They include improving cardiac health, diabetes management, nursing home safety, reducing healthcare disparities, and much more. The QIN QIOs work at the local level. They bring providers from all healthcare settings together to discuss what is and isn't working, share resources and ideas, and work towards common goals. They also invite community organizations to join the conversation. Everything the QIN QIOs do is data-driven. Data unlocks the bigger picture and reveals trends and patterns to help create solutions. Once solutions are identified, the QIN QIOs spread them across communities. Another big aspect of this work is inviting patients and families to take a seat at the table. Understanding the patient's experience is critical. And not only have they taken a seat at the table, they've become leaders in this movement. Patient advisory councils have been formed to guide each quality improvement organization. We still have a long way to go in improving our healthcare system. However, because of the QIO program and its participants, more providers and clinicians are now talking and collaborating, communities have been mobilized, and significant improvements have been made in areas like diabetes care, care coordination, increased immunizations, nursing home care, and cardiac health, just to name a few. So how do we continue to address the urgent needs of our healthcare system? We need you to get involved. Each of us can step up and be a leader in improving healthcare. And by working together, we can keep our communities healthy, safe, and thriving.